Hello and welcome to Meet the Author. I'm today's host Ali. I'm also the managing editor of Arthroplasty. Meet the Author is a regular column of Arthroplasty, the official journal of Asia. In this column, we will talk with different authors about their scientific life and clinical career, as well as their ideas on publication, especially on our journal Arthroplasty. They will lead us into the world of orthopedics with their professional vision and successful working experience. Let's go! Today, we are going to talk about the joint line reestablishment with Dr. Alparslan Ertuğ, head and professor of orthopedic and traumatology at University of Health Sciences, and the Bursa Yüksek Ihtisas Research and Training Hospital. Now it's time to welcome Dr. Ertuğ. He is here and he also wants to share with us his story to be an orthopedic surgeon in Turkey and the way to balance the basic research in clinical practice, etc. Hi, Dr. Ertuğ. Thanks for joining us.
Hi, thank you, dear Ellie. It's a great honor for me to be with you and all the audiences of Arthroplasty Society in Asia. Hi again.
Thank you for being here, and also thank you for contributing to arthroplasty. Joint line restoration is a prerequisite for successful revision new total knee arthroplasty. Your article, Joint line reestablishment in revision total knee arthroplasty, published in our journal, surely provides a new reference for restoring the GL in RTKA. Could you firstly give us a brief introduction to your article?
Yes, of course. As it is known to everybody that joint line has been a predictive factor both in primary and revision total knee arthroplasties. Joint line elevation of more than 8 millimeters has been cited as associated with unfavorable outcomes. In a recent study, this limit value was reported to be as 4 millimeters. As you can easily see that joint line reestablishment is a very important issue, especially in revision cases. Mostly all arthroplasty surgeons, including some pioneers, have used fibular head, medial or lateral epicondyle for anatomic landmarks and some constant values in terms of them in restoring joint line, like joint line should be set 1.5 to 2 centimeters distal to the lateral epicondyle or 2 centimeters proximal to the fibular head. In this study, we wanted to compare some traditionally known and taught distances and the new concept of ratios method defined in recent years related to the adductor tubercle and femoral width in order to reestablish the joint line in revision total knee arthroplasties. We also studied the tibial tubercle and tibial AP length.
That's great. We can have an overall understanding of this article. What do you think is the most interesting and valuable point in your research? How can it guide the clinical practice? Especially, what's the clinical significance of restoring the GL during RTKA?
The most important take-home message is that ratios method is exactly superior and better because it eliminates the disadvantages related to race, gender, and body mass index, as you can easily appreciate. You know that everybody differs in size especially.
Yes, that's true. It's really important to eliminate inconsistency. Then, what are the key points to restore the knee GL? In your conclusion, ATRM method was shown to be superior to the traditional method. What are the main reasons?
First of all, joint line is a femoral issue, not a tibial one. And the most frequent mistake in revision total knee arthroplasties is the use of lower size femoral prosthesis that is put more proximal than where it should be. The presence of bone defects in revisions and re-revisions can be misleading, and surgeons mostly do that mistake. At the end, joint line is elevated inadvertently. Surgeons should be aware of this potential mistake, and by easily measuring in preoperative planning and intraoperatively the measuring of the femoral width, he or she can calculate the joint line settlement in the coronal plane. There is also a joint line. We call it posterior joint line, also known as posterior condylar offset. By using these ratios, posterior joint line can easily be set with regard to medial epicondyle, lateral epicondyle, and transepicondylar axis, so that the flexion instability can be prevented. One can also think that he or she can easily use, for example, the fibular head in contralateral side. This may sound appropriate and wise at first, but the number of bilateral total knee arthroplasty patients is getting higher and higher, as you know. Additionally, the preoperative radiographies of index total knee arthroplasty can be taught to be used as a template. If you find it, of course, you can use it. But the method we used in our study does not need all of these in restoring joint line in revision total knee arthroplasties.
That certainly tells how difficult it is to do RTKA. The new method helps us to avoid the potential mistake in the presence of bone defects, and it proved to be useful in simple one for the joint line restoring in RTKA. Would you please share with us your strategy of doing RTKA? Are there any specific points you want to emphasize in the surgery and post-operative management?
There are certain points that I want to highlight. First of all, pay attention to the etiology of revision. I mean, is it septic or aseptic? And are you going to do one stage or two stage revision? You shouldn't traumatize the soft tissues and respect them. Remove prosthetic components without harming the host bone. I mean, you shouldn't do a bone loss. Be sure about complete removal of the bone cement. Keep in mind the proper component rotation. Pay attention to restore the joint line, of course. This is our topic now. Resurface the patella and use good cementation technique. Follow postoperative pain management. Take measures for infection prevention, of course, and encourage the patient for postoperative mobilization. And lastly, don't forget prophylaxis of deep vein thrombosis and use prophylactic antibiotics for infection prevention.
Thank you, Dr. Ertug, for sharing with us your experience in RTK and GL restoring. That's very useful. I noticed that you have been a doctor for over 25 years. Your valuable share must also come from your extensive medical experience. I couldn't help wondering why you chose to be a doctor, a joint surgeon, as your career.
Yeah, as an orthopedics and traumatology surgeon, as you know, we fix the broken bones, correct the deformities, and to be functional. And with the help of these treatments, increase the quality of life of the person. That's an amazing feeling, as you imagined. I love my job. Being an arthroplasty surgeon is my passion in my career. And to be a good arthroplasty surgeon, you must have good to excellent medical knowledge, and good to excellent technical skills, maximum effort, notice to the details all the time, good communication skills, be with your peers, make podium presentations in Congress and publish high impact journals. Strive for quality of care, that is patient satisfaction, and leadership skills you should have always, because we work in a team, as you imagine. And the last one is the family. As Dr. Chit Ranawat said and presented in his talks, I take these rules as an example for myself and try to apply them. I advise my international colleagues to follow these suggestions. Well, being a doctor means helping people having a good career, being a respectable person. Orthopedics and traumatology obviously increases the quality of life and also lets patients return to their daily life, social and family lives. Coming to joints, An arthroplasty surgeon corrects the deformities associated with end-stage arthritis, basically increases the walking ability, as you can easily guess.
Yes, that's so meaningful to be a joint surgeon. It's really a noble profession. From your words, learning a lot of knowledge and grasping skills are also necessary. Except that, there are also many other responsibilities you have to shoulder. I can't imagine how many high stresses are there in your work. To be an excellent orthopedic surgeon, you must have paid a lot. I'm wondering, how do you deal with these high stresses?
Okay, especially in Turkey, we doctors work under high stress, of course. Also, pandemic has increased the stress many times over. I think the most important method of dealing with stress is to enjoy what you do. If you are dealing with something involuntarily, you will start the game 0 to 1. Then having good to excellent knowledge and trying to be updated with the latest knowledge and controversial issues. I always try to avoid getting annoyed and nervous. Additionally, I love my residents, of course, and love to teach them what I know.
Enjoying what you do, updating your knowledge, and avoiding getting annoyed and nervous. These are certainly good ways to release stress. However, it's really hard to control emotions, especially the negative ones. What do you usually do in your ordinary times to fight the bad emotions?
I always keep in mind my little son Alp, and his presence saves me. Of course, hospital work will surely be over, and there is a social and private life in outside. The world is not just about business life, and I always keep in mind that.
Yes, that sounds very physiological, and your son must be very lovely. You also mentioned you love to teach your residents, so I guess you must be popular with your students. Besides being a surgeon, you are also a professor at University of Health Sciences, which is a new school, also the only higher education institute for health science in Turkey. In terms of education, how do you think to cultivate excellent orthopedic surgeons? What abilities should an excellent orthopedic surgeon have?
Yes, an excellent orthopedic surgeon must have the following characteristics. First of all, he or she must be professional, have national board certification, patient advocacy he or she cares because we want to satisfy patients, our patients, as much as possible. And must be accountable, I mean health professional. Quality of care and evidence-based medicine are the most important things. Continued growth of knowledge and increasing surgical skills are the mainstay in arthroplasty, especially research, self-education, and of course publication are the most important things. Also, teamwork and efficiency and leadership are very important. And the most important thing in life is, of course, the family. I always encourage my residents for research studies. To do these researches, always know the basic science dealing with musculoskeletal system. In orthopedic surgery, we also have good knowledge about biomechanics and biomaterials. This is a unique feature of an orthopedic surgery, especially in arthroplasty, because in arthroplasty we want to use lifelong implants, lifelong prosthesis, as you easily guess. Wear and tribology should be always known and always kept in mind in arthroplasty. I ask and discuss issues related with patients involved with my residents and all the staff in my team. I examine patients with my residents also, and education continues during the surgery, of course. Furthermore, I always follow paramedical issues dealing with my residents also, and I think this is the part of a resident education, I think.
You always help your residents to grow to be a qualified doctor, right? I think they must feel very lucky to have a teacher like you. As you referred, Research study is also encouraged in the way to be a good orthopedic surgeon. For you, how to balance the time between doing basic research and clinical practice?
The essence of this work is to use the time efficiently because I have high volume of patients, as you imagine. And I and other academic staff and my residents regularly come together and discuss controversial issues in the literature. And we always follow the literature, of course. And we plan the research tasks. This is one of the most important and nice parts of our daily practice because we should be between our national and international peers, discuss with them and share the knowledge. We also should present our researches in congresses as well.
That must be one of the reasons why you joined in several orthopedic societies and attended international meetings to give speeches. In your opinion, is making a presentation an important skill for young surgeons?
Of course, as I said before, it is very important. Making presentations increases the self-confidence of the person, I mean the resident or the surgeon. You can measure the initial criticisms and contributions of the research that you have made recently, and you plan to write and feedback from the audience. The invited speeches help also you to convey your knowledge and experience in the fields where you are good at and where you have good knowledge.
Referring to sharing and discussing the achievements, we are also greatly impressed by your high frequency of write papers. A lot of them have been studied for many times. How do you define good paper? Do you have any tips on attracting readers' interest for your research?
Okay, a good paper, a good study must have a proper hypothesis at first and to accept or reject it, of course. To test the hypothesis, there must be a control and an experimental group, basically. Then make the power analysis. If there is not, you may have conclusions that is not real. Materials and methods must also be planned advertently and discuss the primary outcome and secondary ones. Also plan the further studies that may be done in the future, of course.
That's exactly how to organize a good research article, which reports on the results of your original unpublished work. Authors should clearly indicate in the manuscript how their research contributes to current knowledge. Then come back to participating in international conferences and societies. I have another question. After communicating with surgeons from other countries, what are your opinions on the similarities and differences in joint field between Turkey and other countries, especially in other Asian countries?
From the scientific point of view, there is not so much difference in main issues, I think. Differences come from cement usage, antibiotic prophylaxis, the length of antibiotic prophylaxis, perioperative analgesia, etc. There are, of course, similarities between Turks and Asian countries, such as we always love squatting, as you know. Furthermore, we strive in Turkey with the number of cases of neglected developmental dysplasia of hip, as you imagine, especially in women. We are currently working on that. Tribology also needs to pay attention, and we are about to study that issue in total hip arthroplasty. Additionally, instability issues in total knee cases are very important, as you know. We are also studying on that.
I understand. Actually, no matter differences and similarities, the cooperation and connection among doctors over the world becomes more intensive. Asia Society aims to promote the effective cooperation on the most important phases of arthroplasty surgery technologies across the region. Next time, hope you will participate in the activities held by Asia.
I will really be pleased if I have a chance to attend Asia congresses, projects, being a part of advisory committee, being a reviewer in arthroplasty. and face-to-face meetings and congresses. Also, the co-research program. I do love Eastern culture as well. I would like to study with the elegant surgeons of Asia. That must be amazing. I wish I could. I would be great if they invited me to make a presentation in Asia congresses.
Thank you, Dr. Erzduk, for your interest in Asia. You know, Asia is growing rapidly as an influential arthroplasty society in the Asia Pacific. It has held meetings and courses annually. In this COVID-19 era, when offline meetings were nearly impossible, Asia has created online projects, such as Asia Novel Seminar and online summit with APAS and APKS. Furthermore, it's going to host Asia courses with both local professions and international speakers. Other than that, we are going to start our Asia Fellowship this year. We sincerely welcome you to join our online and offline activities, especially offline ones when possible, so that you can have a good experience with Eastern culture. I can volunteer to be your tour guide if you'd like to.
That's amazing, dear Eli. It would be awesome. I do love it. Regardless of the subject, if anything is requested from me, I would like to do it with pleasure and sincerity. And of course, be a part of Asia by participating in all activities of Asia. I hope I will be offered such a chance. And please don't forget to be my tour guide also.
I'm really looking forward to. Thank you, Dr. Erzduk, for sharing with us so much useful experience and knowledge. Our audience must have learned a lot from your words. This is really a very inspiring talk with you.
It's a great honor to talk to you and reach my international colleagues, especially in Asian countries and especially in China. It's an inspiring experience for me also.
Thank you again for your presence, Dr. Erzduk. That's what we have for this episode of Meet the Author. Thanks for watching. In the next episode, we will invite another joint surgeon as our guest. Stay tuned for our next exciting episode. See you!